Hello and welcome. My name is Chris Rowena, Lead Communications Analyst at Health Workforce Development. We're excited that you've joined us today for the California State Loan Repayment Program informational webinar. Before we get started, we want to go over who this webinar is for. This webinar is for new and continuing applicants of the California State Loan Repayment Program, or as we refer to it, SLRP. The SLRP assists with repayment of educational loans for healthcare professionals who commit to serving in federally designated professional shortage areas, or HCAs, at a federally qualified health center, or FQHC. SLRP is administered at the state level by HCAI. Here's the agenda for today. Going to start with this introduction and some housekeeping, followed by the program updates, the application processes and requirements, and then after that we will have a time for question and answers at the end. And speaking of housekeeping, before we begin, I'd like to mention that this webinar is hosted in Microsoft Teams. If you're not familiar with that platform, you can find the chat and the view controls and the menu bar at the top of your screens. When we do get to the Q&A session, we are going to enable the chat, and that will be open for you to ask your questions. So once we get to that Q&A session, you can go up to the top of your screen, click on that chat bubble, and then it'll pop up a screen on the side. You can type in your questions there. And then lastly, this webinar will be recorded today and will be available usually within 7 to 10 business days. With that, it is my pleasure to introduce Matt Garcia, the Program Officer for SLRP, to get us started.
Good morning. Thank you, Chris. I appreciate that. Welcome, everyone. Thank you for coming to the SLRP webinar. We've got a lot of information that we're going to be going over, and as a couple of just quick reminders, everything that we go over today, as Chris stated, the webinar will be available online. We will also have a grant guide available for viewing on our website. We heavily encourage everyone to check that out. All the information provided here will be in that grant guide as well. As Chris also stated, for any questions that you have, please write them down and we will open our chat at the end of the presentation. And please post your questions there. We're happy to answer anything that you may have. Without further ado, we can go ahead and get started. So the California State Loan Repayment Program, SLRP, assists with the repayment of educational loans for healthcare professionals who commit to serving in HCAs and FQHCs, as mentioned earlier. Our goal with this program is to increase the number of trained professionals providing direct care and encouraging healthcare in California and their health professional shortage areas. The SLRP awards eligible healthcare providers up to $50,000 in educational loan repayment grants in exchange for a 2-year service obligation for new grantees or a 1-year service obligation for continuing grantees. Next slide, please. A few things that have changed for this grant cycle in comparison to our previous few grant cycle. The SLRP carries a federally mandated match requirements where all awards made to grantees are to be matched dollar for dollar by non-federal funds by participating organizations and practice sites. As an example, if you, the grantee, are awarded a $50,000 grant, you will receive $25,000 in award funds from HCAI, and the remaining $25,000 will be matched by the grantee's employer, the organization or practice site, for a total of a $50,000 grant award. Please note that participation in the SLRP is optional for organizations and practice sites. And as a result, if a site chooses not to participate or is unable to participate in the program given the match requirement, unfortunately, applicants from that site will not be eligible for the SLRP. Next slide, please. A few key dates. Our application cycle opened on July 15th, 2025. The application will close on September 15th at 3 p.m., and that date is specific. It closes automatically. So if an application has not been submitted by that time, it will unfortunately not be accepted. We hope to have final award decision notifications due in January of 2025, and our anticipated grant start date is for March 1st, 2026. Next slide, please. A bit of funding information. The SLRP is funded through a grant from the Federal National Health Services Corps, the NHSC, as well as other various state grants. The program this year is limited to $333,000 in Song Brown state funding this cycle. Unfortunately, federal funding is unavailable this cycle, but we are hoping that it will be available in the next cycle. As a result, this program is a bit more competitive this year, but we're hoping that with match participation, that we'll be able to award as many people as we can. Next slide, please. Here is our basic layout for our grant terms as well as our grant awards. Full-time awards for a 2-year commitment, you can be awarded up to, crucially, $50,000. If you choose a continuation award after that, for a full-time award, it is up to $20,000, as well as the second continuation year. The third and fourth continuation years are awarded up to $10,000, and any subsequent year after that. For halftime awardees for a 2-year commitment, you are awarded up to $25,000. First and second year extensions are up to $10,000, and third, fourth, and beyond are up to $5,000. So some overview requirements for the SLRP. One is that you have to be a U.S. citizen, born or naturalized. You have to possess a valid and unrestricted license or certification, to practice in one of our eligible disciplines or specialties in either primary care, dental care, or mental health care. You can have no, previous existing commitment or service obligation to any other program that extends past HCAI itself. Two service obligations cannot be completed at the same time for any program as it relates to the SLRP. You also must be free from any sort of judgments arising from federal debt, and you also cannot be in breach of any other healthcare professional service obligation. And as a note, that may extend to other states as well. If you have any sort of federal judgment or breach of contracts that deal with any sort of federal funding, that may also affect your ability to be qualified for the SLRP. Something to keep in mind. Next slide, please. Additional requirements. You also must be a California resident and residing in the state of California. If you choose to apply to the program, you will need to create a user profile in our HCAI funding portal, and you'll need to submit an application in its entirety. Failure to complete the application in its entirety and accurately may result in a disqualification of your application. And we may request, upon review of your application, additional information which will be required to be submitted if requested. This carries for both new grantees as well as continuation grantees. Even if you've previously applied, you will have to reapply again. If you are selected for an award, you'll need to maintain employment for the duration of your service obligation at an approved eligible practice site that has also confirmed its participation in the program and crucially is willing to meet the match award requirements. We'll get into it a bit later, but you do have the ability to switch sites. However, if you switch sites, it does have to be at another approved practice site, an eligible practice site, and they also still have to be willing to meet the match requirement of the award. Next slide, please. Here's a list of all of our eligible professions. We have, I believe, as stated previously, 21 different professions across primary care, mental health, and dental care. You may see on the application a drop-down selection to select your eligible profession, and you may see other professions listed. Please note that if they are not on this list, then they are not qualified for the SLRP. They are just listed for other applications that we use. This entire list is also available online in our grant guide, so you can review that and make sure that your profession qualifies. Next slide, please. The eligible debt requirement is that any government or commercial loans obtained from qualifying lenders for undergraduate and graduate health profession degrees. Qualified lenders are those federally backed lenders subject to examination and supervision by an agency of the United States or the state in which the institution has their place of business. As part of our application review process, we will be reviewing all submitted loan documents in your application. If we do require additional information, we will reach out to request those documents. Next slide, please. Some practice site eligibility requirements, and we're going to spend just a few minutes on this as they have changed a bit from our prior grant program. One, they must be located in a HCA, or designated, as a FQHC. They also, and this is crucial, the crucial change to our program this year is that they must confirm their participation in the program, including their willingness and ability to provide match award funds. The basic process overview is that interested practice sites can reach out to the SLRP. We have an inbox that they can use, that they can submit their request and inform us of their interest in the program. We will create a user profile for them, which will allow them to submit their eligible practice sites. Each site that they submit, we will review and approve its eligibility for the program. The site, as a point of contact, usually designates a site administrator. This can be either from the practice site specifically, or in some cases, an organization may have several sites where one person will oversee the entirety of those sites as a site administrator contact. They are the ones that are responsible for submitting their practice sites to us for confirmation and approval. They are also the ones that will confirm their willingness and acceptance to match any grant funds that are paid out. And they will also be the ones that will confirm participants, are actively completing their service obligations. This will come in the form of employment verification forms, EVFs, which will be submitted, and we'll speak on those a bit later. In addition, they also must be a public or private not-for-profit outpatient facility. And please do note schools, school districts, correctional facilities, prisons, and the like, and providers employed directly by the state of California are not qualified for the SLRP. Next slide, please. Here we have the service obligation requirements for both full-time and half-time grantees. Again, there's a lot of information here. This can be found in our grant guide. The high-level overview is that for full-time grantees, 40 hours are required to be worked for most specialties and disciplines, with a minimum of 32 hours to be worked in direct patient care. We do have a list of disciplines that require a less direct patient care number of hours to be worked per week. However, the 40-hour minimum is still a requirement. For half-time grantees, they work a minimum of 20 hours per week, with 16 of those hours being related directly to patient care. Again, that same list of providers does need to work fewer direct patient care hours, but still does need to maintain the 20-hour minimum. And also, as a general note, any time spent on call is not considered hours counted toward that 40 or 20-hour work week. Next slide, please. Grant agreement deliverables. So every 6 months, the grantee shall submit employment verification forms to us to verify their hours worked and their time missed. Grantees will be notified when EVFs are due. We will send email notifications to your emails requesting that an EVF be provided to us. We will also provide a link that you can download a copy of that form from. That will need to be completed by your site administrators. They are the ones that will verify the hours. They are also the ones that will confirm any time missed during that period of time. Site administrators are also responsible for submitting site payment information in the SLRP funding portal. Please note that the SLRP does not set any payment terms as far as the site match requirement, other than A, they have to pay 100% of the match, and B, the entirety of the match does need to be paid by the time the service obligation ends. So we do not set terms as far as having to be issued a site match payment monthly, quarterly, etc. But 100% of those payments do need to be made by the time the grantee's service obligation is completed. We request documentation to be submitted within 30 days of any sort of request that we have, but specifically here in this example, the grant agreement end date, we will reach out and request lender statements confirming that all grant payments have been made toward your eligible student loans. That is expected to be submitted within 30 days of your grant agreement. Again, we will reach out and notify you that we are requesting that information. Note that if your lenders have changed during the time of your service obligation, that we will also be requesting a letter, document, email, some sort of item that confirms that you had a change in lenders as well. And you can submit payment histories for both lenders if you've made payment toward both of them. Please note that failure to provide any requested documents in the time requested or within a timely manner may result in a breach of contract. And we'll touch more on that in a bit. Next slide, please. We do have communication requirements and requests that you meet those as timely as possible for us. If you are no longer employed by your current approved practice site, we request that you notify us immediately. We request at least 30 calendar days prior to a name change or a mailing address, phone number, etc. If you will be switching your work schedule from full-time to a half-time employment status, we do request that you notify us of that before doing so. If you're unable for whatever reason to meet your service obligation, note that we do allow you to switch from a full-time to a half-time status, but we do not allow a half-time switch to a full-time switch. And once that switch happens from full-time to half-time, you are stuck at a half-time status. Excuse me. We also request that if you plan on taking any leave for more than 30 days, that you notify us. This can be for any reason, including medical, maternity, paternity, vacation, etc. Next slide, please. In addition, we also require that you try and contact us within 60 calendar days if you've selected a new practice site or organization to be employed with. As stated earlier, we will need to verify that that employer is qualified, eligible, and willing to participate in the program, and specifically the match award amount. prior to any employment taking place. If you do become employed at a practice site that has not been previously approved, you may be at risk of breach of contract, and we will require you to find qualified employment or, again, risk that breach. We also request if there's going to be an extended leave of absence that you're made aware of, that you give us just a bit more time in order to note your account and ensure that everything is in order and you're in good standing before taking that leave. As a general note, you, the grantee, are allowed to miss up to 35 days in a grant year without any sort of contract extension. Any missed time above that date will result in a grant end date extension, and those days do reset each grant year. So if a grant year, for example, is from March 1st, 2026 to February 28th, 2027, that date would reset then on March 1st, 2027 and go through February 28th, 2028. Missed days, allowable missed days, cannot be carried over into the following year. Next slide, please. All right, so this is our SLRP breach of contract policy. Again, there's a lot of information here. It can all be found in our grant guide. It will also be found in your grant agreement that you sign prior to your grant going into effect. We encourage you heavily to read through your grant in its entirety along with the grant guide. The high-level information and overview of the breach of contract language is as follows. You'll be responsible for any amounts that were paid to you for any part of the program that you did not complete, meaning that if there is a certain number of months in your service obligation that were not completed, you may be responsible for returning those grant funds based on that prorated time that you did not complete your obligation. In addition, a penalty assessment of $7,500 for full-time or $3,750 for half-time grantees will be assessed on a per month basis based on the number of months that you have not fulfilled your obligation. So if, for example, you did not complete 2 months of your service obligation before you breach your contract, you will be charged a $15,000 penalty as a full-time grantee who breached. In addition, interest on the above amounts that are recovered and due to HCAI for breach will be charged an interest rate, and that is at the state level, and that will be assessed from the date of breach until the repayment of those breach funds as well as grant payments have been made or paid. And that's usually somewhere between 8 and 10% interest rate that is charged on that. In addition to all of that, regardless of the total amount due, the minimum amount that HCAI is entitled to recover will be no less than $31,000 plus the interest, even if the above breach formula results in a lower amount due. So for example, on that for that $15,000 penalty, because that penalty is less than $31,000, you will be charged a minimum $31,000 penalty for a breach of contract. Next slide, please. Excuse me. A material breach of contract that does not have to do with the start or completion of your grantee's period or obligation service is a $31,000 penalty plus interest that is, again, calculated at the state rate. If HCAI has to file civil action to recover those sums. HCAI is also entitled to recover reasonable attorney fees, costs, and expenses directly related to those collection actions. Any amount that HCAI is entitled to recover from the grantee for breach of this agreement shall be paid within 1 year of the date HCAI determines that the grantee is in breach of this agreement. In addition, HCAI does have statutory authority to collect on outstanding debts and may attempt to collect from Franchise Tax Board, Medi-Cal offsets, and other related entities in order to recover those funds. We may also contact the Employment Development Department and the Board of Equalization to obtain repayment of funds owed. Next slide, please. In addition to all of that, a breach grantee will also be disqualified from all HCAI and NHSC loan repayment and scholarship programs. Breach penalties typically range in the realm of at least about $100,000 and often exceed that amount. Excuse me. Again, as stated earlier, we request that grantees please review and read your grant agreements carefully before choosing to participate in this program. You do have a period of time to cancel your SLRP agreement without breacher penalty. That date for this grant cycle is May 15th, 2026. Please note that that is a hard date, and if you come to us on May 16th, we will most likely have to breach you to the fullest extent. So please, again, we request that you really review your agreement, review the terms, review all the terms and conditions, and all of the requirements to ensure that you're meeting your service obligation. Otherwise, not that we ever want to have to, but we have in the past, and we will have to breach your contract if necessary. Next slide, please. And that concludes our presentation. Thank you very much. I'm going to pass it back to Chris Rowena. He's going to host our question and answer session. Again, if you have any questions, we request that you put them in our chat and we'll be happy to answer them for you. Thank you.
Thank you, Matt. As you can see, our team has put a lot of hard work into this program. We're excited that you've joined us today to learn more. We're going to transition to our question and answer session, and in the menu bar at the top of your screen, you can find the button to access the chat feature where you can type your questions in the chat. We're going to do our best today to answer as many questions as we can in the time that we have together. We've got about a half hour left. We do ask that if you have a question that's very specific to personal circumstances, that you go ahead and email our team at slrp@hci.ca.gov so we can best assist you. Also in the chat, we have put the resource links in there, and you can see them there. And I do see that we have some hands raised. We do ask that you either enter your question into the chat, or if you're unable to access the chat due to limitations with your security settings, that you email us at slrp@hci.ca.gov. So let's go ahead and get into our questions here today, starting with the first question. Let's see here. Jump down here. Marissa asks, I currently work at MCSP located in Ione, California. Does this qualify as a rural area in need?
Thank you for the question. Without being able to specifically review the practice site, I could not tell you. What I will say is that if you do have questions about whether or not your practice site is eligible, you can email the general inquiry inbox at slrp@hcai.gov, and we will be happy to assist you with any questions you have. You can submit your request to see if your site is qualified. We'll go ahead and look into it and review it, and we can let you know from there. We do also have online resources that we can provide to you so that you have the ability to check if your site is eligible as well.
All right. Andrea asks, what is the suggested deadline for an employer to reach out to an SLRP inbox and begin the process of being an approved site?
We always request the sooner the better, just so that we can get that process started and that we ensure that you have enough time as an applicant to submit your application to us. Um, the overall turnaround time, if a site administrator reaches out to us, we can usually get their account set up within 1 business day. And once they've submitted their approved, or excuse me, once they've submitted their a site for approval, then we can usually get that reviewed and approved within 1 to 2 business days. Again, this does depend on the communication on both parties. With the SLRP, we strive to answer hopefully same day, if not within 1 business day, to any inquiry received. And so once we can get that process started, the quickest turnaround is usually about 2 to 3 days. Thank you.
Brandon asks, I work for the Department of Mental Health with LA County in a men's reintegration program. We work primarily with court-involved individuals who are also experiencing homelessness. My work site was not available to select from the practice site. How would I go about adding my practice site? Based on the information provided in the slides, does my county employee status disqualify me for SLRP?
There was a lot there. I definitely recommend resubmitting that question to the SLRP inbox. We can certainly give you additional information from there. I would say that just judging off of it, it really depends. If you're currently reviewing, or excuse me, submitting an application and you do have an issue with being able to submit your site, it is most likely because it is not set up in our system as a selectable site. This goes back to the pre-approval that is required for site administrators. Again, something new this year is that all site administrators have to submit their practice sites, and they have to be pre-approved before they can be selected on an application. If you would like your practice site to be reviewed and potentially accepted for the program, we recommend that you reach out to your site administrators, let them know about our program, have them contact our SLRP inbox, and we can help get the process started on that for them.
All right. Brianna asks, are the sites that automatically populate when you search for eligible sites indicative of the sites who are willing to do a 25K match? My work site is not populating within the application. I'm not sure if this means that they are not willing to do the match. I have access to the employment verification form, but I'm not seeing where I can upload it and cannot click next in the application because of an error message saying that I have to choose a listed site. How can I proceed with the application?
Yeah, so same question. So again, because each site for this cycle needs to be pre-approved, if it does not automatically populate, the most likely reason is that it is not currently eligible for the SLRP. That does not mean that it will not be, but that does mean that you'll need to have your site administrator reach out to us so that we can set them up a profile and then get them to submit their practice site for our review and approval. Once that site is approved, it should be available within minutes to select. So we will confirm with the site administrator once that site has been approved, and then they can let you know. And as soon as they let you know, you should be able to then select that practice site. With regards to the matching, it does not necessarily mean that they are willing to match a certain amount. Once that application is submitted and we go through our review process, site administrators will receive email communication that a applicant has submitted for the SLRP, and if that site is willing to match the program. It does not guarantee that they will, and it does not necessarily say that they won't, but it's just asking if they're willing to match, and then we take the review process from there. Thank you.
Next question is, I had a student loan that was federal at first, but then later I transferred to First Mark Services. Will I still qualify?
Most likely, yes. In that scenario, we would probably have to request additional documentation just to verify that it is originally a federally backed loan. We have loosened our standards as far as what is required for our lender statements. But in a case where your lenders have switched from federally backed loans specifically to more private organizations, that's something where we would probably request additional documentation from. And again, that would be something as simple as a letter, an email, something from your previous site or your current or previous lender or current lender that confirms that change. In addition, any consolidated loans, we will ask for additional information. We do need to verify that the loans consolidated are yours and yours alone, and that they are only for the purpose of educational loans. Thank you.
Right. Next question. If I need less than 25,000 to pay off my loans, do I still qualify? And would my employer still need to match?
Yes and yes. So you would still qualify even if you had it lower than the amount of grant award. Our grant awards are up to a certain dollar amount. So that does not necessarily mean that you would get that full amount. It is just up to that amount. If you have less than the maximum amount of award, if selected, we would just reduce your overall grant award, and then that amount would be split in half again between the SLRP, HCAI, and your employer. Thank you.
All right. Next question. I know that my site is an approved site. However, I was wondering, how can I know if they meet the matching requirements? Should I ask my site's point of contact? Thank you.
Yeah, again, there are some sites where an organization may have submitted some approved practice sites, but not all approved practice sites if we've never had an applicant at a certain site ever apply to our program. So if they are already participating with other practice sites already available to select, then they would just need to log into their account, submit their new practice site that you're at, and then we could get that review and approved. We do have site administrators currently involved in our program that are submitting new sites that they may be either obtained or, like I said, no one has ever applied from that specific site before. But yeah, that's something we can certainly get set up for them. Thank you.
Jennifer asks, how can I access a recording of this webinar? Jennifer, I can answer that one for you. We are recording this webinar and we will have it posted on our website on the program page. Usually within 7 to 10 business days, we get that up. We do have to make it compliant with captioning and all of that. You can find the resource link in the chat. We'll post that again. That gives you the webpage for the SLRP program, as well as the grant guide, the funding portal. And again, that email, and I'll take this time to mention again, for those that have their hands raised, we do ask that you either enter chat, your question in the chat, or email us at the slrp@hci.ca.gov. All right, next question. Ruth asks, I am currently completing a 1-year program fellowship that is a primary care MD in FQHC at 0.7 FTE, but will be full-time next year, July of 2026. Am I able to apply for full-time currently?
I'm sorry, I'm not sure if I entirely understand the question, but if you have a current service obligation, Chris, did they say how long that was in effect for? The end date on that obligation?
July of 2026 is when the fellowship is over.
Okay.
And they will go to full-time after that point.
Okay, so unfortunately, July 2026 would be too late to be able to start with our program. Our grants go into effect on March 1st of 2026. And so the overlap would be unallowed since you're already serving a previous service obligation. Once that obligation ends in July 2026, we do encourage you. We anticipate having our next application cycle open July 15th, 2026, and we encourage you to apply at that time. And if you apply as a full-time awardee because you are, or excuse me, a full-time grantee because you are working full-time, that's perfectly acceptable. Thank you.
All right, thank you. And let's see, this question is from Jess Beer. I hope I'm pronouncing that right. And that was probably in reply to their previous question, where they had a student loan at a federal student loan and then transferred it. They say that I applied last year but got denied.
Um, just to start, please don't take that personal. We get so many applications that in most cases we're just unable to reply to everybody who was unfortunately denied for the program. The SLRP is quite competitive. Um, the match also limits practice sites, so that may be an issue. We also have limited funding this year, so it makes the program in general more competitive. If you did not receive a response notifying you that we have selected you for our award by, I'd say, early January, most likely that reason is because you just unfortunately weren't selected this year for the program. That does not mean that you cannot reapply again next year, and we encourage you to do so. And if you ever want any feedback as to why you may not have been selected, you can certainly reach out to the SLRP inbox. Again, the reason is most likely, funding availability, the competitive nature, and the number of applications we get. So it does not necessarily mean that anything that you did was wrong. We just had so many other applicants that, based on our scoring criteria, also available in our grant guide, or at one point available in our grant guide, but we can help with that. You just unfortunately, for lack of a better term, didn't make the cut this year. But again, just because you were not selected for the program this year does not mean that you cannot reapply again next year. Unless you do not meet the requirements, you are eligible to apply each year that you do meet all eligible SLRP requirements. Thank you.
Matt, Jesper did put some additional context later in the chat, said for their particular situation, said I work with a medical group but works at a site different from my location of medical group, who will be participating in the matching. I don't know if the site is approved or not. What do I do next? And so it sounds like there might be an issue with that. My recommendation at this point, Jesper, is it sounds like emailing us your specific circumstances to the SLRP. I think we'll be able to give you the attention that you need for your particular circumstance. It sounds like we have something unique going on there, and we would love to help you out. So go ahead and email us at slrp@hci.ca.gov, and we can help with your specific circumstances.
Yeah, thank you, Chris. And I was going to throw in the SLRP, we do allow you to work at multiple sites within your same organization. You cannot work for two different practice sites associated with two different organizations, but you can work at multiple sites within the same organization. You would list both sites as under your employment history, or excuse me, your employment verification section of your application. In addition, you can also select a future employer. So if you have a job lined up with a future start date already confirmed, you can also list them on your application as well. You can list both a current employer as well as a future employer as well on your site. And with regard, real quick, to there are instances where we've seen grantees that are employed with one site and may be doing business with another site. I will have to get back to you, so please do send me an email. But for sure, the site that you are actually employed at is the site that is required to be approved by the SLRP, and it is also a requirement that that site specifically, the one you are actually employed by, matches the grant award. I will have to do some additional research, so if you do send me an email, we can help you out there. Regarding if you're working at the other site, does it need to be qualified also? Off the top of my head, I cannot remember. It is a rare circumstance. So please definitely send us an email, and we can definitely get you some additional information if you'd like it. Thank you.
All right, thanks for that, Matt. Jennifer asked, does a psychiatric mental health nurse practitioner role qualify?
I'm sorry, I don't know all of our disciplines off the top of my head. I would definitely encourage you check out our list. If it's listed, and if it falls pretty specifically under one of those disciplines, you're definitely encouraged to apply. If it is not on that list, unfortunately, you are not eligible. We do not make that list of eligible disciplines. That is set out by our federal governing agency, HRSA. So they're the ones who determine eligible disciplines and specialties. We just follow the list that they provide us. Thank you.
I do believe looking in the grant guide, I do believe that is answered in there pretty clearly, so should be able to find that answer there. All right, let's see, find out, lost my place on our list
Actually,
here.
Chris, can you hear me?
Yes, I can.
Sorry, I wanted to chime in on that last question. Nathaniel Dixon, Program Manager for SLRP. The psychiatric mental health nurse practitioners, you should be able to apply as simply a nurse practitioner. The program did previously differentiate between nurse practitioners who focus on primary care and who focus on mental health care. This year, you will not see that differentiation on the list, but you will be able to apply as a nurse practitioner.
Perfect. Thank you for that clarification, Nathan.
Yeah, thank you, Nathan. And I did want to add, yeah, we are aware that there are certain disciplines that, although you're listed as one discipline, you can kind of cross over into either primary care or mental health in certain cases. We are aware of that. So definitely, if you do believe that you are qualified and meet one of those disciplines, again, we do encourage you to apply because, you know, and this is something important, I think, that we stress is that we do review each individual application in its entirety. So we will go ahead and definitely be checking to ensure that your discipline qualifies, and if it crosses over, we can work with that. And just as also a side note, we do have an eligibility quiz that is available online for you to take. It is on our website as well, and it will give you a good sort of starting place to be able to determine what's programs in general you may qualify for within HCAI. HCAI has several dozens of programs at this point for various different disciplines and eligibility standards. So we encourage you to take that quiz, and that will help guide you into kind of the direction you may find yourself being able to go and apply to certain programs, ours included. Thank you.
Thank you. And Matt, that's a good call out on that eligibility quiz link. Alma, if we can get that posted in the chat, that would be helpful for everybody. All right. Anita asks, one, if employment start date is in October, are we still eligible? Two, can we apply if employer is not yet finalized? And three, is there a list of approved participating SLRP practice sites?
Thank you for the questions. To answer the first one, in future employment of October is fine. However, you do need to be, you do need to have a confirmed start date. It cannot be, oh, I think I'm starting in October or maybe November. We do need a confirmed start date, and it does need to be listed on the application. We do need you to have qualified employment prior to specifically March 1st, and realistically, no later than early January. Once we make our award decisions, that information is pretty much finalized at that point. And any sort of employment after that date, we would not be able to really get your documents in time. And anything after March 1st, your grant would have already gone into effect. And if you don't have a solidified employer, then we would not be able to work with that. So I would say for sure 100% before March 1st, you do need to have qualified employment with a date set up, and it's preferred that you have something set up as a future employer closer to December or January, allowing us enough time to, of course, verify the practice site, its eligibility, and get your grant documents in order in case that changes. And Chris, I'm sorry, can you repeat the last part of the last question?
Last question was, is there a list of approved or participating SLRP practice sites?
So we do have a list of those. If you do want your site checked, you can send an email to the SLRP inbox. We do also have a geosite that we use to review eligible practice sites or potential eligible practice sites. And we also use a report from HRSA, the Health Resources Services Administration, our federal governing agency that we use to determine FQHC eligibility. If you have several sites that you're looking into because you're looking for future employment, we can provide you that that spreadsheet as well as the link so that you can have the ability to kind of research your sites on your own and what works best for you. Thank you.
All right, thank you, Matt, for that. Next question, Andrea asks, when specifically did the change take place to 1, have federally mandated one-to-one match, and 2, limit eligibility to HCA locations and FQHCs?
Thank you. So, our federal match requirement went into effect this grant year, for this cycle. Our previous 3 grant cycles did not require a match, which is why obviously we did not have one. And the program was run a little bit differently during those 3 years. That's also part of the reason now why we require pre-approval of all practice sites, again, going back to the federal match requirement. However, prior to 2022, so grant 2021 and prior, did have the site match stipulation and had been doing so for all the previous years since its inception. So it was just these last 3 years that the program was sort of a one-off in which sites did not have to meet the requirement. Unfortunately, the feds, they required it again, so we got to follow along with them. So yeah, but that's why. So thank you.
All right, thank you for that. I'm seeing a number of questions regarding the eligibility of site lists. You know, is their site eligible or not? How do they get it eligible? I know we've answered that a few times. So I just want to make sure we call that out for everybody who's been asking that question, is my site eligible, that's the answer for that one. Okay, next question. I am a physician psychiatry resident in a community hospital. Does the residency program qualify for the program?
Residency, I don't know if we necessarily differentiate. We don't, between specifics of what your actual job entails. For us, our requirement is mostly the total number of hours worked and the number of direct patient care hours. So I would say that as long as you're working 40 hours per week and as long as that you're meeting the 32-hour minimum direct patient care requirement, you would be eligible for the program. Of course, at whatever site you were at was also eligible and participating. Nathan, did you have anything you wanted to add? Thank you.
Yeah, I wanted to add that we do require that you be able to, that you have a license to practice without restriction. Okay, so if your residency still has any form of restrictions in how you can practice, that could make you ineligible for the program at this time.
Yes, thank you, Nathan. I did forget to mention that. Yes, you do need to be fully licensed based on your discipline and your eligibility, and it does need to be free and clear of any sort of anything on it. So yeah, that is also a requirement. Thank you.
Hilda asks, hi, I work with the VA compensation and pension. Does this qualify for loan repayment?
I would need a bit more information. If you'd like, please send us an email, slrp@hci.ca.gov. We can assist you further. Yeah, I would, if I had to venture a guess, I'd say it would depend. It would depend mostly on your direct patient care and if you are providing actual health services to veterans. In addition, I know a lot of VAs typically will have some sort of outsourced funding. Note that grant payments, site matching payments cannot be federally funded. So if the VA was qualified and you meet all of the requirements, they would not be able to pay you grant funds out of federal funding. The funding would need to come from an alternate source. Thank you.
All right. I am an associate marriage and family therapist. Can I still qualify?
Unfortunately, not. Associate level licenses are ineligible for the SLRP. You would need to be fully licensed. But again, as soon as you do get your license in full and you become like an LMFT, we encourage you to apply. Thank you.
Brian asks, I'm a contractor with a state prison. Under your practice site eligibility slide, you state that prisons and providers employed directly by the state of California are not qualified. Since I'm a contractor at a state prison, is the site eligible? If it is eligible, is it the contract company or the prison site that needs to match?
In general, contractors, they're always kind of a bit tricky. The contractor itself would need to be the qualified entity. However, because you're providing services at a prison, we don't consider prisons, school districts, again, schools, things of that nature, to be open to the general population. They typically serve a very specific population or group. And so, which is why they don't qualify for the SLRP. I would, off the top of my head, quick answer would be most likely not, because of a third party contractors. A lot of times they're not qualified. And then again, working at the prison, unfortunately. In general, we do also try to stay away or encourage people to stay away from third party contractors. It does and can and has created issues. That's not to say that you can't apply and qualify, but you do need to be specific on your application that you are listing your actual contract, your actual business that you work for and not the hospital you're contracted to. So that's something to keep in mind. Thank you.
Ijoma asks, my office is I believe it's FQHC, by name THE Clinic. It does not pop up in the system. Do I have to tell the administrator about it?
Yes. Again, if you believe that your site is qualified, you want to reach out to your site administration. They'll need to confirm that they are willing to participate in the program, and then we can set them up a profile. They can submit their practice site for review and approval, and then you'll be able to select it on your application. And again, that process, depending on how quick admins get back to us and how quickly we're able to get back to them, can take anywhere from the quickest turnaround 2 to 3 days. So relatively quick. Thank you.
All right. Let's see here. Brianna asks, I know if I know I'm going to go on maternity leave within the next year, should I wait to apply until I'm back?
That is entirely your decision. Again, we do allow 35 days to be missed without any sort of grant extension during a contract year. We know typically, maternity, paternity, things like that you tend to be out for 2 to 3 to 4 months, sometimes longer, sometimes less, but in general. And so once that 35 days is exhausted within that grant year, any missed time will basically extend your grant in date at that point. So the decision is yours. We do allow it. We do not restrict any sort of leave for any reason. And you are given time. And again, as stated earlier, if you go on extended leave, that's just something we would want to be notified of so that we make sure that we track it and can keep your grant in good standing while you're out in case we need to request something. So, but no, we do not prevent you from being able to apply. It's just a matter of how long you're gone and the potential extension of your grant agreement if you're selected for the program. Thank you.
All right. Let's see. We're almost out of time today. Veronica asks, where can I get a copy of this webinar? I looked in the questions, was here, I can't find the response. Veronica, we are going to post a copy of this webinar. It is being recorded. It will be on our webpage within 7 to 10 business days. You can find the link to that webpage in the chat. And then Andrea says, my question was two parts. Still wondering when specifically did the change take place to limit eligibility to HCA locations and FQHCs? I'm hearing from clinicians in my association that the last 2 to 3 years, there were non-HCA and non-FQ deemed eligible.
So for each of our grant programs, in every year, you always have to have HCA and FQHC eligibility. It's just the process in which we reviewed and approved practice sites was different because there was no match. And again, that no match has only been for the last 3 grant cycles, this upcoming one, and starting basically July 15th, 2025, when our application cycle opened, that's when it became a federal match requirement grant cycle again. And again, prior to that, 2021 and prior, it has also always been a matching cycle. So practice sites were always required to match at that point. It's just been these last 3 years. But in any case, for any cycle, there's always needed to be FQHC or HCA qualification there. Thank you.
And I'll add to that that is correct. The HCA and FQHC requirement has always been in place for SLRP and was in place throughout the no match cycles. The big difference with the application process during no match cycles, as Matt has mentioned, is that we didn't have a list of pre-approved sites because without a match requirement, we didn't have to have sites confirm their eligibility or willingness to participate in the program ahead of time. So applicants are able to list whatever site they worked at, and then we checked it on the back end during the review process. If you have heard from clinicians that they were awarded any kind of loan repayment grant when they were working at a site that's not in a HCA or not designated as an FQHC, that may have been for another program, because it's been a hard requirement for SLRP since its inception. So,
Thank you. All right, well, we did get through all of the questions that we could today, and we are out of time. Do encourage, in particular, the 3 that still had their hands raised. If you still have more questions, please email us at slrp@hci.ca.gov, and we'll be able to assist you with your personal circumstances in all of that. Thank you all for your participation in that session. Wonderful questions today, and we hope that it was helpful for you. If we didn't get to your question, again, please email us. We do appreciate everybody joining with us today to learn more about the California State Loan Repayment Program. We're excited to be able to offer this as just one part of our overall health workforce development efforts at HCAI, and are grateful for your participation with us today. We do remind you that those applications are due September 15th at 3 p.m., so don't wait to get those applications in. And we do have a few resource slides for you at the end here. You can follow us, and we would love, for you to go to our website if you haven't already, and look through the workforce tab and see all of the different programs that we have. Again, Matt mentioned the eligibility checker, and Alma posted that in the chat. That's a great tool for you to see what programs you're eligible for with HCAI. We do encourage you to follow us on your social media perusing. You have a number of options here, and if you are awarded, we would love for you to post what you're doing and hashtag us there so that we can see what great work you're doing out in the field. And one of the best ways that you can stay in touch with us and follow along with what's going on with Health Workforce News is to sign up for our monthly newsletter. And you can do that by going to this link right here at the top of the slide, and you're going to fill out your subscription information, and then in the checkbox, make sure you check any of the items under the Health Workforce section, and you will be added to our monthly newsletter, and we will keep you up to date on everything that's going on. You can always give us a call or email us. We do appreciate the emails. It's the easiest way for us to get back to you quickly, but there's our contact information for you to get a hold of us, and please be in touch. We do want to help you be successful in your application for this program. So with that, thank you so much for attending. We do conclude today's webinar, and we hope you have a wonderful day. Thank you.